Good afternoon, everyone. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD, as we are more commonly known, we'd like to thank you for joining us today on this free webinar. We are grateful to the Ministry of Labour for our funding, which supports the delivery of these webinars, and to our presenters who provide their time and expertise. This webinar is part of the Client Patient Handling Community of Practice series, coordinated in collaboration with Public Services Health and Safety Association. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for your questions. We ask that you type your questions into the chat box, and I will relay these questions or their themes, should there be duplication, to our presenters. Should you have a pressing question that cannot be held until the end of the presentation, such as a technology glitch, please type this into the chat box and we will do our best to address it right away. We will be providing you with a copy of the presentation shortly after the webinar, along with an evaluation that we encourage you to complete, as this will assist us in the future delivery and planning of our webinars. Now it is my pleasure to introduce to you my co-presenters, Drs. Sheila Ritcey and Emily King. I am going to read you from the events page on the CRE-MSD website their bios for those of you who have not had a chance to learn about our co-presenters today. Dr. Sheila Ritcey is president of the University of Toronto Physical Therapy and Occupational Therapy Alumni Association. Her interest in competence in the elderly is reflected in the support for client-centered care and health goals that reflect the needs of the individual client. Sheila has worked for provincial and municipal levels of government and has delivered a variety of rehabilitation models in institutions and the community. She works with personal support workers to emphasize the importance of mobility and to reinforce the collaborative role of rehabilitation professionals and support personnel. Sheila is one of the leads of the CRE-MSD seed grant that we are talking to you about today, the development of a PSW training evaluation framework and sit-to-stand training. And I just want to make sure that everyone can hear me all right, so I'm checking the presenter notes here. Yes, we're good. Trying to make this as pleasurable as possible for everyone. Now, to introduce to you our other co-presenter, Dr. Emily King is a CIHR-funded postdoctoral fellow at the University of Waterloo. Her goal is to improve safety and independence in home care. Her work focuses on quantifying the physical demands of home care work and on understanding and addressing the physical, social, and organizational factors that have the greatest influence on home care workers' risk of injury. She holds multiple patents and has contributed to the development of assisted technologies for toileting, mobility, and safe patient lifting. She holds a BSc in mechanical engineering, University of Waterloo, an MSc in biomedical engineering, University of Toronto, and a PhD in medical and industrial engineering, University of Toronto. Emily is one of the leads as well today on the CRE-MSD seed grant that we are presenting. So as you can see, everyone, we have quite a collective here of presenters with considerable expertise, and it has been my pleasure to work with them. Today, we are going to present to you our framework for evaluating PSW sit-stand training. I'm going to provide you with a very brief background of our approach, the care philosophy, and an introduction to the framework. So we know that assisting with sit-to-stand is a common activity for personal support workers. We know if not done properly, both the client and the caregiver are at risk of injury. We also know from data that client handling is a leading cause of caregivers' work-related injuries, often as high as 50% of all lost time injuries. These injuries may be sudden or cumulative musculoskeletal disorders. Proper training of personal support workers is critical to preventing these type of injuries. Our client-patient handling community of practice is hosted by CRE-MSD and PSHSA, where we share current research and its application into practice, and it gives us the opportunity to bring researchers, employers, employees, educators, policymakers, and government together. As a result of bringing all of these people together, dedicated to looking at client-patient handling, there has been a reminder and a reinforcement that there is no standardized training for PSWs through formal education or through employer in-services. And as a result, the community of practice members felt a lack of confidence in their effectiveness of their existing training resources. The membership reported a need for an evidence-based tool to assist in improving the training of their PSWs. As a result, an application was made on behalf of the community of practice, and CRE-MSD funded a seed grant to develop a framework for evaluating PSW sit-stand training and a preliminary analysis of sit-stand techniques. Today, we are presenting to you the evaluation framework, and we will address the preliminary analysis of sit-to-stand techniques at another time, should this be of interest to you. So, how did we arrive at what we're going to present to you today? We collected PSW sit-stand training materials from across Ontario and Canada. There was a descriptive analysis of these training materials carried out. We then drafted the client-patient handling training framework, and we pulled together a multidisciplinary panel who reviewed and updated this framework. That panel, and you will see who it consisted of at the back of our presentation, it consisted of a range of physiotherapists, occupational therapists, a nurse, health and safety association personnel, kinesiologists, personal support workers, researchers, an engineer, and a gerontologist. As a result of the work of this multidisciplinary panel, we have this presentation for you today on a training framework. So today we are going to share with you the purpose of this training framework. And this training framework is designed to assist in evaluating your PSW mobility and handling training. It does make specific reference to sit-stand training, and we believe that these principles can apply to other core skills. Now, we do make the assumption in the development of this framework that this training should be a part of a broader safe mobility training program. So over to my colleague, Dr. Sheila Ritcey.
Good afternoon, I'm Sheila, and I've been picked to talk about the restorative approach because I've been studying it for quite a few years and watched it develop globally and now see it coming to Canada. The focus of this approach, and it can be called restorative, it can be called reablement, it can be called capacity building. We're choosing to call it restorative because that is the most common term that is being used. The focus is on supporting clients to achieve their optimal function with the lowest level of ongoing support. So we are engaging the care recipient to the greatest possible extent in their own mobility and daily activities. This approach promotes maintenance and restoration of function. It improves self-rated health, improves confidence and well-being, and decreases the need for ongoing care. The approach is being used in many countries now, and these countries are aging at the same rate that Canada is. The increase in elderly, which contributes also to the increase for care, is the same in most developing countries. However, the institutional care in most of these countries is increasing at a very slow rate, and that people are being maintained in the community, in their homes. I think the focus has been on experiential life, not just on physiological existence. Why do we use this approach? We find it's very good for the client. It helps clients to stay independent in everyday living and social activities. The PSW assistance supports the rehabilitation goals, which are client-centered and evidence-based and time-limited. It's good for the caregiver. Obviously, there's a reduced risk of injury when client participation is much more comprehensive, and they are participating in the activities instead of having things done for them. The doing things to, for, rather than with the client is considered a negative approach. It's encouraging a more passive role. It's encouraging deconditioning. It leads to loss of client confidence, loss of skills, and belief in personal abilities. The reablement or restorative approach focuses on people's experiential life, their ability to live their day and participate in their community, with family, with social activities, whereas the more negative approach of doing things for people contributes to a passive approach and contributes to loss of independence. So the focus here is very much a restorative approach. Oh, I'm sorry I've lost you here. Oh, got into it, but it went back. Sorry, a little technical glitch here we're just fixing. I guess one of the issues that gets raised with this approach is it time effective? Does it take longer? Now, the research that we've looked at says it is a time effective approach. You might spend a little more time at the beginning because you're shifting the client's understanding of the nature of services. You're also shifting caregivers' belief in this new approach. It's not new to many people, but it is relatively new in some of our services here. So we are trying to shift a philosophy of the care that's being given. It increases clients' independence and capacity, and we need a consistent message from both supervisors, care coordinators, and we need a similar message being given by all staff when they are actually dealing with the clients. This approach is now being used in Canada. Sorry, I'm just going to shift there. We are using it in Central West. It is being used in Peel. The challenges for people doing this approach, the care plan has to reflect the restorative approach. It cannot be an old model when we're using a new model. Staff have to be supported to do with rather than to do to and for. So OT, PT, PSW training already emphasizes this, but we need to make sure it's actually applied in the real world. We need a consistent approach from the whole care team. We need communication within that care team that supports this philosophy. It is possible. It's happening, as I said, now in Central West with good results, and has been extended in the places that it is actually being used. We hope that there will be more information for you. This is an interesting subject, and I think we could give you a lot more information as to how this works and why it is being so successful and why it is now being used in Canada. It is certainly cost effective, it is certainly time effective, and it absolutely increases quality of life for both caregivers and obviously for the clients. The question we have here, is there an interest in a webinar to learn more about this approach? And that question, I think, has been added to the evaluation. So that is, obviously I'm a fan of restorative care, but I think it's well reflected around the world that this approach is increasing quality of life, keeping people active and keeping them living independently in their communities. I'm going to pass to Emily King, who's going to talk more about the framework and the structure that we're using.
Thanks, Sheila. So my plan today is to give you an overview of the framework. We will also make the framework document available to you when we make the slides available to you after the webinar. So the basic organization of the framework, which is based on these principles of restorative care, is that we'll cover what content do we think you should be exposing your PSWs to. This may not all be covered in depth in the sit-to-stand training. There are some elements where we want to make explicit what knowledge we think PSWs need to have ahead of time. And this may be covered in some of your other moving and handling training, and that's fine. It's a great thing to refer to in your sit-stand training as well to make sure that we're constantly reinforcing those core principles. But there's a bunch of stuff you'll see up front, and if it's not covered in detail in your sit-stand, that might be okay if it exists in the rest of your program. So we'll talk about the content, then we'll talk about the presentation and approach that we believe is important to make the training effective. And finally, the framework provides an opportunity for the assessor to make comments on how the training is overall and what next steps will be required. So we're going to spend most of the time talking about the types of content that we think should be present in the framework. And there's a preview just on the left-hand side of the slides as to the areas we'll be covering with regard to caregiver knowledge, what happens before the move, what happens during the move, what should happen at completion, and other resources that need to be available to staff to set them up for success. And in the framework, we just ask the assessor to note what's covered well, partially covered, and to add, and we leave some space for notes on that. So you'll see that when we send out the full framework document after the webinar. So to jump into the content, we talk a lot about what the baseline caregiver knowledge base should be. And I'm not going to belabor a lot of this because I think this is quite common content, but just to give a list for people to verify. There are some basic principles about human movement, which are essential if people are going to do their own troubleshooting towards safe human movement of their own, and if they're going to understand the movement of the humans they're helping. So this involves, basic knowledge about good posture and symmetry, how gravity works, core principles of postural balance, when somebody is balanced or unbalanced, some basic anatomy of the back joints, understanding natural curves that they should be aiming to maintain, and injury prevention. And here we've specifically highlighted that it should be a positive and proactive approach. So it shouldn't catastrophize. It shouldn't say, there's a real risk of getting hurt here, guys. You might have any of these problems. It should say, if you do these activities appropriately, then actually the risk of injury is quite low, but you need to be aware of the following. And so a positive and proactive approach. Here's how to prevent yourself from getting hurt. There are also some core principles of sit-stand transfers. Sometimes when sit-stand transfers are done badly, it's because there is no attempt to replicate a natural movement pattern. It's somebody trying to haul somebody else out of a chair. And one way to set people up for success is to have them think through, what does a natural sit-to-stand look like? What are we aiming for, essentially? And especially emphasizing that for success, you want to start with edge sitting. You can't get somebody out of a chair easily if they start sitting from the back. And yet, that is quite common. And when we were reviewing training materials, one of the, I guess, shortcomings that we saw in some of them is that some people, even in their training images, show a start position that's quite far towards the back of a chair. So making sure that all the messaging is consistent about the first thing that you do is you get somebody to edge sitting. So making people aware of that's quite important. And making that the top of mind. Knowing the benefits of sit-stand transfers is also important. You don't want to be trying to avoid these transfers, and this is part of the restorative approach. You want to be encouraging people to do these transfers if they can. There are huge physical and psychological benefits to getting mobile, and I think many PSWs are trained in that and understand that that's one of their goals, is to get people mobile. And that's good to understand. End goals of the activity are important to understand. Why are you doing this? And also taking a look at the abilities and potential abilities of a client. If you see, they're on the cusp of being able to do this more independently. They're on the cusp of being able to participate more fully in the transfer. That's the kind of thing that as client condition changes, PSWs are really best placed to observe and report back to the rest of the care team. So it's a great thing to make them aware of as something that they should always be looking for. Now, in terms of choosing a movement strategy, there are some core principles, and this is one of the places where, sort of putting our biases up front. Sheila presented the care philosophy. We're promoting restorative care. That seems to be the best way to go for best outcomes for clients and caregivers. So, what does that involve? Well, firstly, we've got balanced decision-making. Sometimes the messaging that PSWs say they receive from their agencies is that the client's needs come first. And that's important, but the caregiver is important too. And so we need to balance the client's goals, preferences, the dignity of risk. They can take risks if they want to, but they don't have the right to put the worker at additional risk. So the worker's right to be safe needs to be something that workers are aware of and can think about in deciding with a client how to carry out a movement. And that includes awareness of relevant legislation. Workers knowing when they can say no and how to say no, if necessary. So PSWs need to be aware that it is appropriate for them to be balancing their right to be safe when they're as well as the client goals, the client preferences, and the client's dignity of risk. So the balanced decision-making piece is important to emphasize so that staff know that they don't have to do things that are too dangerous and how to avoid that. That said, they're not forcing the client to do anything the client doesn't want to do just because the staff prefer it. The clinical order of preference in choosing a movement strategy. Now, this may vary according to local organizational policies, but generally there should be a preference for more independent movement where possible and more participation where possible. And there should be some guidance to staff as to what we should be trying to get people to do if they can. These involve, though, the PSW observing what would be most appropriate to do now. And often the guidance provided to PSWs is there is a strategy prescribed in the care plan and you must follow the care plan. So there should be guidance to staff on what to do if the strategy prescribed in the care plan contradicts these principles. And this could happen for a number of reasons. This could happen because the client has improved. This could happen because the client has deteriorated. This could happen because the client's just having a bad day. And so staff need to have some flexibility to account for how the staff member's doing that day and how the client's doing that day. And they need to know what to do if they see a problem with what's written in the care plan, because it may be that more assistance or less assistance is required. So that guidance should be presented up front in the sit-to-stand training or in any moving and handling training. Okay, so we then get on to what happens before each move. First, the PSW should consider, in the moment, the abilities and characteristics of each person. So the person to be assisted, their behavior, cognition, physical capabilities and characteristics, and the caregiver's capabilities and training. And these are in the moment, and there are a number of good tools out there that, little acronyms that can help remind people what do you look for at each moment. And we're not saying that, any one is the best or the worst. It's just there should be some element of this that is reminding people you have to consider the abilities each and every time. And then there's the element of affect, which isn't always mentioned in the training, but which is important. It's the caregiver's calm and confidence and not seeming rushed are also important to setting up a successful transfer. It puts people in sort of the right mindset. Then there's the selection of the approach for a transfer and the rationale. And ideally, this selection of approach matches the approach listed in the care plan. But as we said before, if it doesn't, there needs to be some way of knowing how to select an approach that will be appropriate now, on this move, on this day. And whatever that approach is, the client needs to know what it's going to be, and they need to agree and give permission for this if there's going to be a change. There should also be basic risk assessments conducted before each move. And again, there are a number of trainings have quite good tools for this. Reminder checklists, little acronyms, whatever it is. Reminder to check the environment. Is the physical environment appropriate? The lighting's good. The temperature's appropriate. There's adequate color contrast if necessary to indicate hazards. Risks to the client and the caregiver, risks to the client and the caregiver we list separately. But in both cases, we're looking at, is this strategy going to potentially cause physical discomfort or psychological discomfort? And psychological discomfort is sometimes neglected. But there are some movement strategies that involve closer personal contact, which may be appropriate or not under different circumstances. So considering the psychological discomfort associated with a move is also important. So those elements should be there. And then there has to be the physical preparation of the people, the environment, and the equipment. And we've just got a checklist. And again, there are reminders for this in many of the trainings we saw. In terms of content, when we get to the move, this has to start with good instructions to the person to complete a task. So there's a reminder to be, if possible, within a client's visual field when communicating, to encourage a client to do as much as possible, and to provide clear communication. And we recommend that trainings provide examples of this, not to expect everybody to know what clear communication will sound like, but to provide some examples and to give people a chance to practice, to sort of preload words that would be appropriate. We recommend simple, positive action words. And one example of this that we feel is particularly powerful is ready, steady, stand, as opposed to 1, 2, 3. Because you never know if you're getting up on 3 or if you're getting up right after 3. But ready, steady, stand sets up the rhythm just the same way, but is clearer. And it gives a specific action each time. In terms of the move, the next issue is that the contact between the person and the caregiver. And caregivers often feel very naturally that you want to be hands-on and touching somebody, and that might be friendly or reassuring, but there should always be mindful of the purpose of a physical contact. Is it just to provide reassurance? Is it to steady somebody? Is it to actually provide a little force? And then I know one of the things that Sheila has said is the hardest thing for PSWs and OTs and PTs is knowing when to be hands off, when to just, as one of her colleagues does, put their hands behind their backs and let the client try it. But so what's the purpose of the physical contacts? And can you provide, make sure that you can provide the support, ideally without physical or psychological discomfort. The next element of training should talk about techniques at each level of a movement selection hierarchy. And we say that the hierarchy, really this is what are the techniques that you can use with more independent people? And what are the techniques that you can use to provide greater and greater support as people require that? So there should be techniques that are recommended, and it's a good idea to talk about not just what techniques you would caution against, but why you would caution against these techniques so that people can have the potential harms in mind as they are selecting an approach. As Catherine mentioned, we do have a preliminary analysis of this that we did with our multidisciplinary panel that takes into account many reasons that one might choose or not choose given techniques. And we're still refining that, but that's something that we'll be hoping to share in the coming months. Oh, sorry, I just want to go back to when we say techniques cautioned against and why, one of the reasons for saying why is that we recognize that while PSWs ideally are following a care plan and are provided with guidance on how to complete activities, sometimes in the moment, that plan won't work and they need a new plan. And so we know that PSWs are constantly problem solving in the home, and we need to provide them with the tools to know why things weren't recommended, just as much as they know why things were recommended. So completion. At the end of a standing activity, the PSW should be ensuring that the client is safe and ready for the next activity. So they should be reminded to confirm that the client feels stable before disengaging. And this is a key time where positive wording is important. And Sheila especially wanted to emphasize this based on her years of experience. Avoid suggesting symptoms to people. Not, are you feeling dizzy? Or anything like that. It's positive wording. We've used, do you feel stable is one option. There may be other great ways of phrasing that. But yeah, the training should, again, suggest some wording, suggest some good kinds of phrases. And then a reminder to ensure that the client can reach anything they need for their next activity, like walking. And finally, there should be a reflection on the activity. So the caregiver should just do a little check. Could the client have done more? Is this something we could move towards? And were there any risks in what we did, or are there different ways that we could do it to minimize the risks or promote the client's activity? There's an opportunity to check in with the client. Was that okay? Is that the way we should be doing it in future, or should we do something differently next time? And then also, in retrospect, were other resources required? Is there potentially equipment that the client would benefit from that's missing? And is that something that a PSW could be reporting back to their supervisor, or if they're in touch with more of the care team, to an OT or a PT or a nurse? We have another point here on resources related to organization-specific contacts and procedures. So we know that many PSWs work for numerous organizations. They'll work in long-term care and for a home care agency or two, and everybody will have slightly differing policies and procedures. So in the sit-stand training or in any mobility and handling training, it's good to remind people of what the specific policies and boundaries might be around the move. So who can help with what challenges and how to contact them? Are there any gaps in coverage, for example, weekends or nights, where they're going to need to be a little more independent in solving the problem in the moment? What are the procedures if they need to request additional resources? And if you're able to provide some kind of resource card or, quick reminder, if there's a file right on the, the front of that smartphone, if there's a little app for what to do to provide help, don't assume that people are going to remember that stuff, because they work in many cases for so many employers that the wires are going to get crossed. And so that's the content that we think should be covered. Now, we'll move on to presentation and approach, and I'll hand over shortly to Catherine, who's just getting into position here. And in the presentation and approach, we're asking you to think about, does your training use an approach extensively to a moderate degree, or is this an area where there's opportunity for improvement? Catherine.
All right. Thank you, Emily. Well done. So, in the next part of this framework, as Emily has mentioned, we have highlighted the format your training should look at, the educational approach, the evaluation, and the tone of delivery. So I'm going to briefly talk to you about these elements. So in terms of your format, you want to communicate your training in a range of approaches. And by that, we suggest that there should be text. When possible, you should definitely have images, videos, and demonstration. There should be opportunity for physical practice, and training should also involve case studies. And the reason these formats have been suggested is based on the adult education model by Cole. All students deserve the opportunity to learn in a way that meets their learning style, and not everyone learns in the same way. So when you are training, just as when you're instructing or teaching, you want to provide the material in a variety of different formats. You want to expose your trainees to new knowledge. You want to give them an opportunity to reflect on the knowledge. You don't want to just be an information dump. You want to give them the opportunity to think about, based on what you've told them, what are they going to stop doing, what are they going to start doing, and what are they going to continue to do. And you want to actively try new strategies and techniques with them. Also, as part of the training that you provide, it's important that you assess their knowledge. Did they learn something today? So sometimes a pre and a post test is good. If you don't have that opportunity, at least a few basic questions after the training. You also want the trainees to evaluate how you were as a trainer so that you can learn from that and insert anything that you could do differently next time. And I have to say, we saw that evaluation component is often missed. So do look at your training to make sure that you've included that. Part of presentation and approach also includes the tone. And Emily and Sheila have both talked about this. You want to focus on how to do the job safely, not just on injury risk. You don't want to terrify your trainees and have them focus on what might happen to them. Rather, you want them to focus on how to do the job safely. So that positive, proactive approach that CRE-MSD often takes and provides you with their resources when you get a chance to have a look at the CRE-MSD website in more detail or at msdprevention.com. You also want to consider the client and the caregiver's needs equitably when you are doing your presentation. You want to, as we've mentioned before, make sure your language is concrete. You want to avoid acronyms and euphemisms. Now, as part of the training, you also want to have what we call an assessor's summary and next steps. So you've done the training. You, as a trainer, want to reflect on what are the strengths of the current training? What did you hear from your trainees? What are the areas of improvement that need to happen? And what does the framework say about areas for improvement? So as Emily has mentioned, you are going to be looking at your training against this framework, and you will see where you might want to add things or change it up a bit. You also will then want to devise a plan for revising the training. And after all is said and done, you don't want to just close the book and say, okay, did that training tick? On to the next. You want to be able to evaluate how is the PSW doing with what they've learned. So you want to see that the training is actually being implemented. And that's where you'll see also whether or not there needs to be things added to the training. So what we have presented today in a nutshell, and you will see it much more comprehensively when you get these 4 pages of our framework, 5 pages of our framework, you will be able to go through the framework and see what you have, what you don't have against what we're suggesting you need, and then what you want to add. And Emily has a comment here.
The framework version that we're sending out to you, we are still listing as a draft because we would also like feedback from the community of practice, from all of you on the call today, about whether you think that there's anything that we're missing, anything that we have in there that you would question. We do welcome your feedback, and the version of the framework that you will receive has my email address and Catherine's email address at the top, along with a request for any of your thoughts on it.
Thank you. And we would be remiss if we didn't acknowledge CRE-MSD for the seed grant funding to allow us to work with the community of practice to do this framework. We'd like to thank PSHSA for their support and for making sure we had a health and safety representative and personnel on the expert panel. And we would like to thank you, our COP members, for sharing your resources. Kelly, our research assistant who did the descriptive analysis, PHA Home Healthcare who provided us space, TransCare Community Support Services who provided PSWs, who are often left out when we are developing materials for them. And on behalf of Emily, we would like to recognize MyTex and CIHR for her fellowship funding. We have listed below for you all of those individuals that assisted us that were part of the multidisciplinary panel. So now it is over to you, our participants, to pose any questions, and the 3 of us will do our best to address your questions. So I see there is some typing happening. And I know we have provided you a lot of information in a short time, but we did our best to leave lots of time for questions. So we have a comment, and I think it's a very valid comment, that we add the discipline to the individuals on the multidisciplinary panel. And I think that's a good idea, because you may see that maybe we miss someone. So while we have an OT and a PT and a kinesiologist and an engineer and a nurse and a health and safety specialist and some researchers and a gerontologist and PSWs, who knows? We may have forgotten a discipline. So Lee, I'm thinking that that's what you meant, but do type me a message if I missed that. And Tara is looking forward to the slides. And yes, people will get a copy of this presentation along with the framework that we were presenting. And Francis from PSHSA has indicated that most Ontario health and safety legislation clearly states the employer established written safe work practices, establishing clear roles and responsibilities. And thank you for that reminder, Francis. It is clearly important, and we know most organizations do have this in place, and for those that are working on it, we certainly are here as a resource to help. And again, the website MSD Prevention has some useful resources to assist with this. Lee has asked us why we haven't provided them with the 5-page summary so they could discuss the framework with us now. One of the reasons is it was a lot of information to send all at once, and we don't often know who is calling into the webinar, so we will definitely send you a copy of the draft framework. And as Emily mentioned, you are welcome to provide us feedback on it. Today, we did present to you the content of it, but you will now get to see it in the 5-page non-PowerPoint format. While we're waiting for some more questions, I'm wondering if Emily or Sheila would like to take this opportunity to reinforce anything or comment on anything that you think we missed or rushed through. And
it's Sheila here. I guess I just wanted to emphasize that the restorative care approach is here in Canada. It is being used. It is getting good results, as it has around the world. And to emphasize that this kind of a change, the emphasis on revising training for PSWs is a global approach, that we can't change the kind of thing we're talking about without changing the philosophy that supports that. So the idea that people hang on to their independence, that they hang on to community living, is incredibly important, and that it does seem to work, and that a very small percentage of people actually need to be institutionalized. So the fact that it's cost effective, time effective, and hanging on to quality of life, I think, is important for us to consider as we do this. It's a big change. It's a big change in philosophy. And I think for adult learners, and I'm an adult learner, I still am an adult learner as a senior, but the emphasis is today knowledge, skills, and attitude. And the attitude is also extremely important. You have the knowledge, you have the skills, but the philosophy that supports that is incredibly important.
I see a question here from another one from Lee. Have we looked at different training for PSW students versus training for present PSWs? And Lee, the answer to that is that this was a rather small grant and we had to control our scope somehow. So one of the compromises that we made was that at present we've only looked at training for present PSWs. So this is the in-service type training that's offered. If we'll send you the framework, and if you have comments on it as compared to training for PSW students, we are hoping that the framework we've set up can be fairly easily adapted to other purposes like that. We'd love to talk to you about that. So yeah, take a look and we can engage afterwards.
And also, I'd like to mention that one of the wonderful attributes of getting a CRE-MSD seed grant is it prepares us for an application for a larger grant. So as we learn about more things that need to be researched and gaps, that enables us to take this knowledge and apply it into a larger grant application. All right, any other comments or questions? And as Emily has indicated, please do look at the framework and our slide presentation. And if there's anything that you think we have missed, please let us know. I'd like to mention, just in closing, and I'll ask Emily or Sheila to speak to this, that we have, as Emily mentioned, worked with the expert panel on sit-stand techniques. So we do have a table, a draft of a table where we have looked at what these different techniques are, and we are continuing to work on that.
Yeah, so I think we think that that is a full discussion in itself that we would like to have with you and not need to abbreviate. We don't feel that what we have is quite ready for prime time yet. We are working on refining it, and we'll hope to share it with you in the near future. And we can discuss whether you agree with the assessments that our multidisciplinary panel has made. I know it was important to us to have a lot of different voices in the room for that one, so we did have, you know, PSWs, nurses, OTs, PTs, kinesiologists can all see different advantages and different disadvantages sometimes. And so we had some quite interesting debates in our workshop about, you know, pros and cons of each approach and whether they should be, you know, kind of banned outright is a strong term, but whether there are some we should say never do, or whether they might, in limited, challenging circumstances, have a place. And that's a conversation that we'll hope to have with you as well. And when we present, we will try to make sure that that presentation goes well under time so that there is a lot of opportunity for conversation afterwards. And we'll look forward to sharing that with you as well soon.
Well, I want to thank everyone for their accolades. It's very encouraging. A lot of work has certainly gone into this, and certainly we want to thank all of those on our multidisciplinary panel.
Sorry, I see just as Catherine's closing, I've interrupted her because I see Lee has another question. Have we looked at steps for management when client goals put PSWs at a high risk? Superb question. We do have a side piece that we've been developing on this that we've been calling something like setting your PSWs up for success. We've realized that it can't all be included in PSW training. It can't all be put on the PSWs. There can be a lot of conflicts that arise. And so we're putting together what we hope will be a useful set of guidelines where an organization can consider, you know, we can give this training, but are PSWs set up for success? Do they have the supports they need from the supervisors? Do they get the resources they need in a timely enough fashion? That sort of thing. And if client goals put PSWs at risk, talking about what are the procedures for negotiating that. Because the client goals and independence are incredibly important, but you know, there's the your right to swing your fists ends at my face principle as well. And so they don't have the right to injure a PSW. And so that's part of the setting your PSWs up for success piece that we'll look forward to sharing with you as well, but is still being formulated, I would say. So if you have thoughts on that that you'd like to send us, I think you will have our email addresses in the framework document, and we would love to have that conversation.
Okay, Sheila, would you like the last word?
I'm just going to say a quickie that it was Lee who raised that question.
Yes.
That the focus of balanced decision making, that both the needs and rights of the caregiver and the needs and rights of the client must always be balanced for the activity that's being done. So I think this focus very much emphasizes equitable rights for both the caregiver and the client. And we're always considering that. And each decision is unique to a specific client and should be addressed that way.
And it certainly is covered in how we have organized this framework through the core principles and what the content suggests that you have in your training and in your training program at large.
And does need to be supported by the agency policies that will help to protect the PSWs as well, to your point about, you know, if client goals put a worker at risk. So that's certainly part of that, setting your PSWs up for success. That we'll look forward to your feedback on that as well.
Thank you, everyone, for joining us today, and thank you, CRE-MSD and PSHSA, for your assistance in supporting this client-patient community of practice. We look forward to sharing with you the resources that we've presented today, and please do fill out your evaluation so we know what we can do differently and learn from today's experience. Thank you again, and have a wonderful rest of the day.